Hello everyone. Today's topic is scalp. First of all, what is scalp? The soft tissues covering the vault of the skull is called scalp. Now coming to layers of scalp. Scalp is made of 5 layers. Skin, connective tissue, aponeurosis, loose areolar tissue and the periosteum. The first letter of all the words forms the term scalp. First is the superficial layer, that is, skin, which is hairy. Second layer is dense connective tissue, which is divided by many fibrous septa into small pockets. Third layer is formed by the aponeurosis of occipito-frontalis muscle. Fourth layer is by the loose areolar tissue, and the fifth layer is the periosteum covering the skull bones. Beneath that is the skull bones with the outer table and inner table and diploe present in between. The emissary veins connect the fourth layer of the scalp to the intracranial dural venous sinuses. The fourth layer, that is the loose areolar tissue layer, is called as dangerous area of scalp. The reason is the emissary veins which course in this region transmit the infection from scalp to cranial venous sinuses. That is, from extracranial to intracranial. The first 3 layers, that is, skin, connective tissue, and aponeurosis, together form surgical layer of scalp or scalp proper. This is a schematic representation of scalp. 3 major sutures, that is, lambdoid suture, sagittal suture, and the coronal suture. Let's see the blood supply of scalp. Here we have represented for one side of the scalp. From the front, it is supratrochlear artery, then supraorbital artery, and the superficial temporal artery supply in front of the ear. The posterior auricular artery and the occipital artery supplies behind the ear. The occipital artery is a tortuous artery. Now nerve supply of scalp. Each side of scalp is supplied by 10 cutaneous nerves. From the front, the supratrochlear and supraorbital are named corresponding to arteries. Next 3 branches has the name temporal in it. Zygomatico-temporal, temporal branch of facial nerve and auriculotemporal nerve. The next 2 branches has the word auricular in it. Posterior division of great amicular nerve and the posterior auricular nerve. The next 3 branches has the word occipital in it. Hence named, lesser occipital, greater occipital, and the third occipital. First 5 nerves supply in front of the ear, and the next 5 nerves supply behind the ear. Venous drainage of the scalp. The veins of the scalp accompany the arteries and have similar names. Next, let's move into lymphatic drainage of scalp. Anterior part of scalp is drained by preauricular and parotid lymph nodes, whereas the posterior part of scalp is drained by posterior auricular, mastoid and occipital lymph nodes. Clinical aspects: black eye. Following any trauma, the collection of blood in the loose areolar tissue layer, that is, the fourth layer of scalp. The blood which is collected will extend anteriorly into the eyelids. This is because the frontalis muscle has no bony insertion. Second one is the sebaceous cyst. It is caused due to the blockage to the discharge of sebaceous gland. The sebaceous cyst has a punctum at its summit. It is a clinical point to differentiate it from dermoid cyst. Third is cephalhematoma. It means collection of fluid beneath the pericranium. It should be noted that the collected fluids do not cross the suture lines. This is the representation of skull bone, and its covering, the pericranium. The fluid tends to collect beneath the pericranium. It is limited by the suture, and do not cross to the opposite side. Reasoning out. Wounds of scalp bleed profusely. Why? Because scalp is highly vascular, and the arteries anastomose with nearby arteries and the contralateral. That is, with the arteries on the opposite side. Second one is bleeding of scalp is difficult to stop. Why? It is due to the Rick anastomosis. And the walls of the blood vessels, tunica adventitin is tightly adherent to dense connective tissue layer, that is. So they cannot constrict when cut. So direct pressure over scalp is needed to stop bleeding.